I'm excited to introduce our special guest, Jessica Gilliland. Jessica is an LMFT, which means licensed marriage and family therapist. Throughout her training and career, she's prioritized developing expertise in helping clients manage body image and eating concerns. She currently works at Balance Health and Healing in Linden, Utah, where she provides therapy to individuals, couples, and families managing eating disorders, depression, anxiety, relationship conflict, and other concerns. Jessica also runs an educational Instagram account at jessicagilliland.mft. Her presentation today is titled Body Image and Sex in Marriage, where she will teach you how body image and sexual health can impact each other, how partners can support each other and overcome body image related struggles in their sexual relationship, and help you understand how to foster healthy body image. She will also hold an anonymous Q&A session for the final 15 minutes of this 1-hour webinar. So feel free to write your questions down now and as they come up, or just whenever they come out throughout the webinar, and you can so you can remember them for the portion of the Q&A portion of the workshop. Jessica will also be asking some questions throughout the webinar, so you are welcome to participate in the chat. The chat is enabled. And if you want to request a CEU from me, you can email me at marriagecommission@usu.edu to request a certificate. All right, Jessica, thank you so much for being here. I want to just turn the time over to you and let you have as much time as possible.
All right, great. Thank you so much, Camilla, for the intro. So I'm really glad that I get to participate with the Utah Marriage Commission. I think this is a great resource and excited to talk about this topic. So body image and sex in marriage. This is a topic that I've been excited to share about because I think this is an issue that all couples are going to encounter to some degree at some point in their relationships. So I'm excited to dive in. So as was shared, our objectives are going to be about body image and sexual health and how those two impact each other, how to foster healthy body image, what healthy body image is, and learn how partners can support each other. So just kind of as an introduction, I hope that this will be a really practical webinar for those participating. I hope that we'll be able to kind of walk away with some strategies and really concrete things that you can do to improve in all of these areas, right? Body image, sexual health, and your marriage in general. And so I'm hoping that this will be, a practical application. And I know that everyone's situation is different. So a lot of this will be more broad and more general. But that's also part of what the Q&A is for, is to help answer kind of more specific questions. Another kind of caveat, a lot of the research that I drew from was on heterosexual cisgendered couples. And so, I just want to make that clear that a lot of these things can be applied to couples that are in other demographics, but that the majority of the research that I'm drawing from is based on heterosexual cisgendered couples. Okay, so let's dive right into body image and sexual health. So one kind of question that I want to just frame this with is, what happens when we're in our heads instead of in our bodies during sex? Right? Like, what are the consequences of kind of being in this more cognitive and even anxious space? Because that's really where body image happens, is in our minds, right? That body image is not a physical experience necessarily, but it's kind of a mental interpretation of that physical experience. So as we talk about body image, we're going to kind of frame it that way, as body image is happening in our minds and is going to impact the way that we experience something happening in our bodies, right? That sex happens both in our minds and in our bodies, but that the physical experience is one of the most important elements, right? So we're gonna kind of go through a bunch of research that I hope, like I said, will be relevant and will be useful. I'm hoping to break it down in a way where it's like, okay, yeah, that makes sense, and I can see how that applies to my real life situation, right? Another thing that's, I think, important to talk about is that bodies change, right? So that body image is kind of a moving target throughout our lives. Our bodies are going to change for a whole lot of reasons. Weight, changes in weight, aging, and all of the changes that come with that, pregnancy and postpartum, and pre-menopause and menopause, and all those things, disability and injury, and a whole bunch of other things. So I'd actually love to hear in the chat some of the things that impact body image as far as the way your body changes throughout the course of your life. If there's anything else that we didn't cover in this little list, I'd love to hear kind of what your thoughts are on that. Because body image is something that, you know, is okay. Illness, yes, absolutely. Yeah, illness can for sure impact, yeah, health changes for sure, right? The stress, oh, that's a really good one, right? Lots of really good hair loss. Yes, yeah, that one can be really impactful. Not just weight, but weight placement. True, right? Childbearing and menopause. Oh, all great answers, because you know, this is something that is just a fact of life, that our bodies change, and so the way that we feel about our bodies is going to change as well. Media and social pressure, absolutely, right? Surgeries, yes, yeah, and surgery and illness, comparison, right? Mental health, yeah, that can change the way that we perceive our bodies, right? Mental health concerns, right? Yeah, a lot of really good answers, and that are coming in here. Okay, yeah, and I know that not everyone can see the chat, so I'm trying to make sure that I've read all the answers that have come in. But because body image can be kind of a moving target, I think this is a good topic to revisit, not just, you know, at one certain point in your marriage, but often throughout your relationship. That as that conversation continues, there are going to be different ways that you want and need to talk about that, right? So we'll get into that too as well, just ways to talk about that. Okay, sexual functioning, yes, absolutely, right, that our sexual functioning can change as we age, or pregnancy or postpartum disability and injury can affect all of those things too. Okay, yeah, thank you so much. So an idea that I want to help guide us as well, just again, kind of by way of introduction, is that unhelpful messages about our bodies are everywhere, right? Some of you mentioned that in the chat, that societal messages, or, you know, kind of expectations or comparison can really, really impact the way that we see our bodies. So Emily Nagoski is a researcher who researches sexual health and sexuality. And she wrote a book called Come As You Are, which is a really great resource. I'll include that at the end of the presentation. But she talks about this idea of having weeds in the garden of your sexuality, right? That, you know, just like you have a garden, you might have planted your tomatoes and your string beans and your peppers, and then you get these weeds that come in and are just interfering and taking up space where you want to be growing your vegetables. Okay, and so you get to decide which ideas to nurture and which ones to weed out. So all of us are going to have weeds pop up in our gardens for various reasons. And we can sometimes have a hard time recognizing what is a weed and what is something that we want or need to keep in that garden. So as we go through this presentation, I'd like for you to kind of keep that question in your mind. What are some of the weeds that are existing in the garden of your sexuality as a couple or as an individual? And what do you want to do with those, right? What do you want to do with those, those kind of unhelpful ideas? Excuse me. Hopefully I don't lose my voice right here at the beginning of the presentation. But thinking about what kinds of messages are there, and also where they came from. What are the origins of some of those unhelpful messages, right? Okay, so let's dive in a little bit into the research. So self-criticism, right, which is often what we think of when it comes to body image concerns, is a form of stress. And we know that stress leads to behavioral inhibition, right? Or stress is going to get in the way of us doing the things that we want or need to do. And so if we think about body image concerns or body image criticism as a form of stress, it makes sense that there's a link between that stress and sexual dysfunction, right? And there are lots of studies showing us that there are clear links between having stress and having sexual dysfunction. And so that stress can come from, you know, just your everyday stuff. It can come from big life events, but it can also come from body image concerns. So some of the forms of sexual dysfunction that might show up, and that this study right here, the Bodenman 2006 study, shows that specifically are linked with body image stress are, you know, hypoactive sexual desire, or just low sex drive, right? Or even sexual aversion, right? Not wanting sex in such an aversive way. Also linked with vaginismus, right? Tension in the vagina, which can cause pain with intercourse and can be very distressing. And then premature ejaculation for men, that can be a great source of distress too, right? And that and that all of these things are going to interfere with sexual functioning, which is also going to create more stress for most people, right? So if we view body image distress as a form of self-criticism and a form of stress, that can help us kind of have a framework of how we want to manage that, how we can manage that in a relationship. Because treating it as something that is unhelpful can be a way to kind of step back, right? Because often when we're criticizing our bodies or having body image concerns, we're pretty close to that issue and we take it as truth rather than as, oh, this is a source of stress that I might want to step back from and learn how to manage in a way that doesn't let it interfere with my life. Okay. So moving on with this, that, you know, part of how body image can also impact us is not only is it stressful, it changes our perspective on how we see ourselves and how we see others. So we all know what objectification is, right? Being seen as an object for kind of external qualities only. And, you know, even more specifically, sexual objectification, being seen as a sexual object rather than as a whole person. So most of us are probably familiar with that term of objectification, but the idea of self-objectification is one that I think is really important to be aware of and understand in the context of body image. So self-objectification is taking an observer's view of your own body or seeing your body kind of from the outside rather than living in your body from the inside. So being disconnected from your experience of being in your body. You know, seeing yourself as parts instead of as a whole body or a whole person, right? That often when we are struggling with body image concerns, we might say like, oh, I just see like my stomach or my legs or my chin or this other part of my body that I'm dissatisfied with. And that's a form of objectification, right? Kind of seeing ourselves as bits and pieces rather than as a whole being. And so that can have a lot of impact on our sexual self-esteem and sexual satisfaction, right? Because like we said at the beginning, sex is an embodied experience, and seeing yourself as an object or seeing yourself from the outside, looking in, wondering what are people thinking of me? How do they see me? What do I look like in their eyes? You know, how does my body appear to others? Can pull us right out of our physical experience and get us stuck up in our heads. So this is a really important thing to kind of practice wrapping our heads around, because it can be different to see our body image struggles as a form of self-objectification. But once we start to see it as that gives us the opportunity to say, okay, how do I want to see myself? Because we know that experience of self-objectification can have a really negative impact on our sexual lives, right? That when we're missing out on the sensation and the physical aspect of sex, it's probably going to be less enjoyable, right? And less appealing and less connecting when it comes to our partnerships, right? So this is a really important thing to be aware of and how it impacts us in our sexual relationships. Okay, and we'll get into more of that of how to combat that in the second section when we talk about fostering healthy body image. Okay, so, oh, and you might see a poll pop up on your webinar here. That's just asking if you are watching with someone, just so we can kind of get an accurate count of who's attending right now. Okay, so body image and sexual satisfaction, kind of moving on to other factors that impact body image and sexual function. So what you think your partner thinks of your body, if you're a woman, has more impact on your body image than what your partner actually thinks, right? So I've got this little scale over here, right? The research is really interesting, saying that what women think their partners think about their bodies is going to influence their body image more than what their partner's actual opinion or assessment of the woman's body is. And for men, it's a little bit different. Men's perceptions of their female partner's satisfaction with their own male body and women's actual perceptions of their body are both going to predict male body satisfaction, right? So that, you know, this is also one of those ways where we can kind of be aware of, yeah, what is my mind saying versus what is my physical experience when it comes to connection, right? Like if my mind is saying, oh, my partner doesn't find me attractive, or my partner's thinking this negative thing about my body, or, you know, my partner doesn't like this, or doesn't find this sexy, or doesn't find this attractive, that can impact the way we see our own bodies, of course, right? That we're relational creatures. And so what we think others are thinking about us can have a big impact on how we see ourselves. So also another thing that is important to kind of pay attention to when it comes to body image and sex. Okay, so I kind of gave you a whole bunch of research that hopefully it was boiled down into something digestible and understandable and applicable. But just kind of to summarize here, body image can have an impact on all aspects of our sexual functioning. There's a recent study that came out just this year that talked about how couples with lower body image satisfaction are going to have less frequent sex, lower sexual satisfaction, and then lower overall marital quality, right? So that body image can have a huge impact on whether or not couples are even having sex, how satisfied they are with that sex, and how satisfied they are with their relationship in general. So it really can be a very impactful thing. And if you're watching this webinar, or if you were interested in this topic, chances are that you've encountered at least some of that in your life, right, in your relationship. And so just knowing that, yeah, that's valid, that it can have a really big impact on how it feels sexually in your relationship. Okay. So I want to just kind of pose a few questions that could be helpful. When we think about that garden at the beginning, right, the weeds that exist in that garden and how we might be able to kind of decide what do we want to keep and what do we want to take out. I think these are some questions that can be helpful for guiding that process. How would you like to feel about your body, right? Maybe not how do you feel about your body, but how would you like to feel, right? That's kind of like identifying what do I want to grow in my garden versus just seeing, okay, here are all the weeds that are getting in my way. How do you hope your partner will feel about your body, right? Kind of going back to that idea of, our partner's perceptions of our bodies can have an impact on us. And it's okay to have some goals or hopes for what they think about your body. How do you hope your partner will feel about their own body, right? That this is reciprocal and relational, that, it's not just what's happening in our own bodies and our own minds, but also what's happening for our partners that can impact sexual satisfaction and where body image can play a role. Okay, so and these are questions that, as we go throughout the webinar, if you have ideas, I'd encourage you to just jot them down and maybe even share them with your partner, right? That these can be really good discussion questions for you to approach as a couple. Okay, so we're going to move into talking about healthy body image, what it is and how to foster it. Because I think all the research can be really interesting. It can make sense, oh yeah, that makes sense, that's a struggle that we have, or that's a vulnerability that I have when it comes to my relationship with my body. But here's the section on kind of what do we do about that? What's the target that we can aim for instead of objectification and self-objectification and dissatisfaction with our bodies. Okay, so I love this quote. This is kind of the spine line of how I think about positive body image. So positive body image isn't believing your body looks good. It is knowing your body is good regardless of how it looks. And this quote is by Lindsay Kite. She's a researcher on body image resilience, actually from the University of Utah, and she and her twin sister have published a lot of really helpful blogs and books and workshops and things that are meant to foster healthy body image and help create body image resilience. So, knowing that your body is good regardless of how it looks, because I think sometimes we can aim for the wrong target when it comes to body image. We might think, okay, bad body image is not liking the way that my body looks. So good body image must be loving the way that my body looks. But really that's more of the same, right? That's more of us placing our value and our self-esteem and our ability to give compassion to ourselves on appearance, whether that's for worse or for better, right? And so this perspective of, I know that my body is good and looks don't really have anything to do with my body's goodness, right? That can be a kind of a novel concept, but one that I think is really, really important. Someone shared a really good insight in the chat here that I'd love to read. I would hope that my partner would love me for who I am, not put my flaws into consideration. Even if my partner really loved me, I'm sure we could work things out. I would like to feed good things into my body image. Yeah, I think that's a great connection to this quote, right? The way we see our own bodies, the way we see our partner's bodies, the way we hope they'll see us has to be more than just one-dimensional, more than just appearance-based, right? And that view of body image can be so powerful. Okay, so along with that, your body is not the problem, right? That sometimes we think, okay, if I want to have better body image, I need to fix my body, right? I need to be thinner, I need to be more muscular, or I need to be more fit, or, I need to dress better, or I need to change the way that I groom myself, right? That those things can influence our body image, but if the more time we spend trying to fix our bodies, the more our bodies are going to continue to feel like a problem. So body image work is an inside job, right? It's not external work. It's about doing the internal, mental, and emotional work of changing how we view our bodies and other people's bodies. So a lot harder, a lot less concrete than trying to lose weight or trying to gain muscle or whatever it might be, but also much longer lasting, right? A much more solid foundation to stand on when it comes to all of those changes that we talked about, that our bodies are going to change. They're going to change frequently throughout our lives. And so if we're able to do that internal work, we're going to be more resilient to those changes and less susceptible to having kind of those body image crashes of as we experience those changes in life. Right? Okay, I'm talking too fast here. I kind of have to like take a breath for a second, but I'm really excited about diving into this. So, because I want us to, even in this webinar tonight, challenge some of our ideas about bodies and what makes a body a good body or an attractive body or a sexy body, and really start to question, okay, are these weeds? Are these things that I really want to be growing? And what do I do if they're not? Okay, so I collected these images here, and I'd like to just kind of pose a couple questions. So I'd like for you to take a moment and just look at each of these photos of each of these individuals here. And as you're doing that, I'd like for you to notice any judgments that come to mind, any words or descriptors that come to mind, any evaluations or feelings that come up as you look at these people's bodies. Right, because we're looking at both, right, people and bodies, right? That we exist in bodies, and that's what people see when it comes to us. Yeah, and yeah, we have a really good point brought up here. Your message is valid, but unfortunately, media and advertising constantly sell us an unrealistic view of what is desirable or good in a body, and that is very hard to counteract. Absolutely, it is very hard to counteract, especially because it comes from everywhere, right? It comes from a lot of different places. And so doing that internal work of challenging it can feel like we're just shouting into the void, right? Like trying to challenge some of those ideas. But that is something that we still can do, even though it can feel like a really uphill battle. So, as you're looking at these images and thinking about what comes to mind for you, I'd like for you to also think, which of these bodies are good bodies? And how do you know? Right? What's the criteria for which of these is a good body and which ones are bad or not good? Okay, and notice how you feel as I ask that question as well. Okay, and now pushing even a little bit further, if you were to meet these people, right? If you were to run into them, and I were to ask you to share that assessment and tell them you have a good body or you don't have a good body, how would that feel if I were to ask you to do that? Right. So just looking at some answers coming into the chat. I don't think we can define that. It's up to the person existing in that body and how they feel about their own body, right? That inside experience. Right. Another answer here. Honestly, they are all good. Some people have distorted views on people without meeting them. Absolutely. Right. Often because of that conditioning where we're taught that certain bodies are good and certain bodies are not good, we can create judgments that really aren't useful or fair. Right. I feel like they're almost all doing everyday tasks. I feel much less judgmental towards them and myself when it doesn't necessarily look posed or like it's supposed to look good. It just is. Yeah, no, I appreciate that comment, right? That, yeah, our bodies are meant for us to be doing things in our lives, right? Not just being looked at. I think it's much easier to build up other people and tell them how great they are than it is to tell myself is. I'm unfortunately, and this is another comment, I'm unfortunately harder on myself than others. I wouldn't call any of their bodies bad. Right, and yeah, I think that makes sense, right? That we would never even think to say to some of these people, oh, your body is bad because of this, right? But we can be very quick to say some of those things to ourselves, whether that's in our own minds or in our partnerships, right? Or the way we talk about ourselves when we're with others. Honest, there are some things that I say in my inside voice that I don't say with my outside voice. Absolutely, right? That we might be making assessments or evaluations of people that we wouldn't share with them out loud. Right. And that's part of why I ask the question of what would happen or how would it feel if I asked you to share those things out loud, is that there's kind of that dissonance of like, okay, well, I wouldn't share that with them. And why not? Right. And why do I maybe share some of those things with myself? Okay. If we're being honest, no one would happily choose an unfit or disabled body. We've been socialized to assume that people who are heavy are not healthy, and that becomes our justification for negative judgment. Right. No, right. And that, it was deliberate of me to choose bodies that are in a variety of different situations, right? Because we get messages about size, weight, skin color, ability, age, right? All of those things were subject to assessments, and we are kind of given messages about what is good in each of those categories and what is not good. What if we asked what is good in these pictures? Does that change the perspective, right? I agree that with the person that said that media has a very narrow definition of what is a good body, and it does tend to influence us, but all bodies are miraculous in how they can function. Okay, yeah, that we can just look and say like, okay, yes, this person looks like this, and kind of list external qualities, but then we're missing out on a much bigger picture of the person in that body, right? And that's something that we can apply in our own body image relationships too with ourselves is, yeah, when I look at myself, I see my body, and what else do I see, right? Do I see my body's function? Do I see my body's experiences? What do I see? Okay, so that actually is my next slide. So rather than asking, what does my body look like? How does my body look? We can start asking those questions. How does my body feel? What sensations am I experiencing? Right, this is an especially important question when it comes to sexual functioning. Right, that's where we're going to find the most pleasure, find the most satisfaction, find the most connection, is in that internal experience versus how does my body look as I'm doing this, right? And another question that was also brought up in the chat, what can my body do? What are its functions? Instead of saying, oh, okay, well, my legs don't look the way that I want them to, what are my legs doing for me? What's happening in my legs and my blood vessels, in all of the functions that are happening in my body? Right. Okay, I'm going to go to the chat real fast and just look at some other questions. I think it's natural to have some sort of identifying and judgmental word. However, it's choosing how you can take that judgment and turn it into a positive perspective. Seeing people for more than their bodies. Absolutely, right? That idea of, yeah, do I want to kind of let this grow in a weed-like way, or do I want to cultivate something else? Right. What about preference, attraction, etc.? Does this mean we're judging? That's a really good question. So, and this might be one that we could spend more time on in the chat, or in the question and answer, but, preference and attraction, etc., are all good things, right? That can be an element of how we connect with others and how we even connect with ourselves, right? It's not bad to like or dislike or be attracted to or not attracted to certain things. And if that's the only element, right? If that's kind of the one-dimensional view of either yourself and your body or someone else and their body, then chances are that's going to be kind of a shaky foundation, kind of like we talked about. So not a bad thing, absolutely. And, there's more to it than that. Okay. I understand what I should ideally say, but most of these bodies aren't what I would choose. Health and health risk also makes a difference. Absolutely true, right? That yeah, we don't get to choose the bodies that we're in, and we also don't get to choose how other people's bodies show up, right? And that they don't get to choose the bodies that they show up in necessarily. So, this is kind of a separate topic, but the research on health at every size, that's kind of a foundational set of research when it comes to body image work and eating disorder treatment, and even weight management treatment, as some people might call it. But that, if we focus on appearance and size and weight, then we're more likely to experience negative outcomes than we are if we're focusing on adding in healthy behaviors in our lives, right? That, for example, we can't judge someone's level of fitness or level of cardiovascular health or their cholesterol or any of that based on their appearance, right? That thin people we might think of as fit or healthy, and they might not be actually healthy inside, right? And then the same thing goes for someone in a larger body, that we might assume health outcomes when we really can't, right? That weight is not necessarily a good predictor of actual health outcomes. So another thing to kind of consider as we think about bodies, right? Okay, and then this last question, what can I experience because of my body? That kind of leads me to this quote over here. This is again from Lindsay and Lexi Kite in their book, More Than a Body, that was recently published. And I love this quote. They say, look around, lots of people look lots of different ways and have lives filled with fulfillment, love, connection, success, and all the things you've learned to associate only with thinness, youthfulness, and narrowly defined sex appeal, right? That kind of, as has been shared in the chat, we are kind of fed this message over and over that the only way to be attractive, the only way to be happy, the only way to be lovable, the only way to be sexy is to be in a certain body, right? Usually a thin, young, able body, right? And that's absolutely not true. That's not the case. That might be true in the media we're consuming and the movies we watch. And when we look around at the real world, there are people in a variety of different bodies, of different sizes, ages, weights, colors, and abilities that are living fulfilling and happy lives. And of course, there are people that are struggling, right? That's also true. But as we expand our view of what makes a good body, we're more likely to see goodness in our own bodies and have some of those positive outcomes that, body image resilience can have, which are basically the opposite of what we talked about in the first section, where body image vulnerabilities can have a really negative impact on our sexual functioning, our relationships, and a whole bunch of other things. Right? Okay. So with this, I think it is really important that we are intentional about the media that we consume, because, like we've talked about, this is like just such a powerful force in our world today, especially now where we can consume way more media than we could even 10 or 15 years ago, or that we have so much more access to media and it can be so much more of a constant in our lives. So view media critically. How are different types of bodies portrayed, right? Like when I was making that slide with all the images, I was actually noticing that as I was searching for kind of stock photos of people in larger bodies, right, fat people, that it was really hard to find images of their faces, right, and their bodies, right, that often it was like, okay, here's just like a set of legs walking down the street, right, or here's a larger body sitting on a bench and we don't see their head, right, kind of even that of like, we don't want to show this person, right, because we're communicating that their body's not good enough for us to also want to see their face, or that we should hide their face for them, right? And even, I just use the word fat, right? That you might have a reaction to that, but we usually don't have that reaction to the word thin, right? That we have a lot of messages that are fed at us that even tell us that fat is a bad word, right? Or that it's a negative word, or it's a rude word, when we wouldn't say the same thing about thin, right? So does the media that you're consuming add to a narrow view of what a good body is or what a sexy body is, or is it giving you a flexible and expansive view? Right. And then the second step of this is curate your media, delete, unfollow, stop watching, or take a break from media that is not helpful to your body image or to your partner's body image or your perception of each other's bodies, right? That it's okay to cut those things out and limit media that is going to increase body criticism and self-objectification. Because we talked about body criticism as a form of stress, right? That self-criticism can be a form of stress, and that can have negative impacts in so many ways. And so it's okay for us to decide to reduce that stress by reducing our consumption of media that we realize, oh yeah, this actually does not help my body image, and I don't need to participate or view it. Right. So, and we'll talk more about how to do that as a partnership in our last section too. I want to be mindful of time because I want to make sure that we have plenty of time for the question and answer. But so this last section of how to support each other, I really want to give you some practical things that you can do. So and I'll start off with just the idea of reducing objectification in your relationship. So if you notice yourself having a reaction that like there's no objectification in our relationship, just know that it's okay if there is, right? It makes sense that there is, because we're all subject to some of these messages, right? Those weeds that get planted in our gardens, not by our choice, but because that's kind of the world we live in. And it's okay for us to recognize those things and try to reduce the amount of objectification of ourselves or even of our partners that might be happening because of those weeds that have been planted, right? So seeing your body and your partner's body as a whole body, right? That you and your partner are not just bodies, you're whole beings. And also you have bodies, right? But that your bodies are not just appearance. They're not just something to look at, right? Another quote from the Kite sisters, they often, drive home the mantra, my body is an instrument, not an ornament, right? It's something that works, that can do things, that can experience things. And it can be seen, right? But it's not just for looking at. So if we can focus on function, sensation, and aesthetics, right, of what we find attractive, what we do find sexy, as well as sexuality, that can give us a more well-rounded view of what our bodies are, the roles that they play in our lives, and how our bodies and our partners' bodies allow us to experience different things. Okay. And then, of course, talk about how objectification and self-objectification are impacting you and your relationship. Those are really important conversations to have, right? That when body image insecurities come up, that, you know, there might be some things that need to be talked about, right? Weeds that have been planted in the garden that we can explicitly bring up and discuss with our partners, that can be really meaningful. Not easy conversations to have, but really meaningful and helpful ones to have. Okay. So some other date night discussion questions, and I won't spend too much time on this because this is more just a resource for you, just something to begin discussions. But where do you notice body image impacting our sexual relationship? Just opening that conversation up. What messages about our bodies are helpful or unhelpful to our sexual relationship? Where are the weeds that we need to get out of our garden? Where did those weeds come from? Might be another question to ask and discuss together. And what are your goals for the health of our sexual relationship? Right, kind of having those couple conversations where the two of you get to discuss what you're hoping for, what needs to change, what you want to see happen in the future of your relationship can be really good ways to be intentional about supporting each other in both having a healthy body image and having a healthy sexual relationship. Okay. So another tool that can be just really practical. So going back to that image of this little balance scale, right? That in the research on women's body image, what the woman thinks that their male partner thinks has more of an impact on their body image than what he actually thinks. So, you know, being able to kind of get on the same page there, right? So giving appearance-based comments that are positive, right, that are complimentary, actually does correspond with higher body image satisfaction for both partners, right, for males and females. However, you know, negative commentary is going to be associated with lower marital quality by way of lower sexual satisfaction, right? So not as sexually satisfied and therefore not as satisfied with their marriage for wives only, right? So we kind of see evidence of that, this tipped balance here. So, you know, that this is a way that you can have a really practical and positive impact on your partner's body image is to share helpful comments, right? And so again, if that were the only place where you were sharing compliments and comments and supportive words for your spouse, that would be a problem, right? If you only ever complimented them on their appearance or on their sexual appeal, that could end up being a problem, right? But if that is part of the whole of your relationship, right? If you're intentionally making positive comments about your partner's body, and not even just about appearance, right? This research talks about appearance, but, you know, all aspects of their body that you appreciate, that can lead to positive feelings about their own body and better sexual satisfaction and relationship satisfaction. Okay. So here's an exercise that I think is one that can be really, really practical. It's not a sexual exercise, but it's a physical exercise that can help you practice getting out of your head and into your body, right? We kind of posed that question at the very beginning. What happens when body image struggles take us out of our bodies and into our heads, where we're experiencing worry or anxiety or insecurity? How do we get back into our bodies? So this is an exercise that I'll often share with clients in session or for them to do at home, is practicing giving each other a hand massage, right? Take turns being the giver and the receiver, and practice noticing the sensations in your hands, right? Noticing how the muscles feel, how your tendons feel, how your joints feel, how the skin feels. Notice how the lotion feels. Notice the temperature of your partner's hands. Notice how you're experiencing that touch from your partner. And inevitably, your mind is going to start drifting off to somewhere else, right? That, you know, in this exercise, there might not be specific body image concerns that happen with your hands, or there might be, right? That might be a vulnerability for some people. But wherever your mind is starting to drift, whether that's to your to-do list or, you know, to other concerns that are happening in your marriage or to your body and how it looks, practice using that sensation in your hands as an anchor point, right? Practice bringing your attention back to that place and see what that's like. And you can do that as both the giver and the receiver in that exercise, right? Noticing the physical experience and allowing that sensation to ground you when your mind starts to drift elsewhere. right? That can be something that can really be powerful when it comes to having a satisfying sexual relationship, is practicing being able to bring the focus back to the physical sensations, to your experience of those sensations, rather than kind of being in your mind away from that physical experience. Right? So this is kind of a non-sexual way to practice that skill, which can also carry over into your sexual relationship. Okay. All right, and then another practical tool, and we kind of already touched on this a little bit, but taking a break from media as a couple can be a really great thing. Because like we've talked about, a lot of the messaging that we get about our own bodies or about others' bodies can come from media, and a lot of those messages can be unhelpful because of how narrowly they define what a good body is. Right. And so taking a break from that, and decide together how many days or what times of day you're going to take a break from media, what types of media, whether that's you're going to delete Instagram or you're going to take a break from television or movies or whatever it is. And then also what your goals are for that break. What improvements do you hope to aim for? Whether that's, I want to think more about my body as an instrument instead of as an object or an ornament to be looked at. Or I want to appreciate my body more versus compare it to other people's bodies, right? Or I want to appreciate your body more versus comparing it to other people's bodies. And then, of course, talk about your experience of what felt different. What was that experience like for each of you? What parts of that experience helped you notice what maybe are weeds in your garden and what are things that you want to keep cultivating? That can be a really practical way to just experiment with, what happens when we kind of bring our focus inward towards our own bodies and our own experience versus kind of being in our heads with what media tells us is good or bad. All right. So as I talked about in the earlier slides, these two books are ones that I would really recommend to pretty much every couple, right? That this book, More Than a Body, the one on the left there, talks about body image in many different facets and how we can strengthen body image resilience. This is a really good one, especially for partners to read. It is focused more on the female experience of body image, but I think there are principles that can definitely apply to all genders, and also helpful for the insights into the female experience. And then the book on the right there, Come As You Are, is again written by Emily Nagoski and shares a lot of different things that have to do with sexuality, again, from the female perspective. So there is the whole section on body image and how, we can reduce body image objectification and understand ourselves as whole bodies, not just as objects or parts of bodies, and also talks about some of the research on weight and size and how health and weight are not necessarily correlated in the ways that we sometimes assume that they are. So another great one to check out. Okay, and we're here at the end, here's my references, and I'd love to get into the Q&A now, just so we can give as much time as possible to questions. Okay, and I think I know how to do this. So I'm gonna, okay. All right, so let's see. Let me just scan through here and, okay. So here's a question that came up. I apologize if this question is covered already. If it was, please ignore, but could you touch on or address how pornography could affect both the viewer and their partner and their perspectives on or reactions to bodies and the sexual relationship? Okay, great question. Yeah, and there is another question that's very similar. How does pornography impact body image? Right, so I'll admit that this is not my area of expertise, that I probably don't know the research as well as some clinicians would, but I think we can draw from some of the principles that we talked about today, that, that pornography can have an element of objectification, right? That just the way that most pornography is manufactured is for the visual experience, right? That we're getting the visual and aesthetic experience of sex without the embodied physical experience of sex. And so that can for sure change the sexual experience of the people impacted by that pornography, right? That, everyone's experience with pornography is going to be different, especially, in a couple relationship, but just kind of paying attention to that principle that, having a visual only experience versus, a connected embodied experience is going to make a difference. Right. And so, I can't say across the board, like pornography, yes, or pornography, no, as far as impacting body image for better or for worse. But I think that principle can be a good one to pay attention to. And, even using some of those questions that we talked about in regards to media, does this media impact my body image or my view of my partner's body in a helpful way or in an unhelpful way? That those can be guiding questions for couples who are trying to manage, how pornography impacts their relationship. Okay. All right. Another one that says, I blame my husband for my body image issues. I didn't realize how sexual men were before getting married. I have a small chest and have grown to hate my body. How do I mend my relationship with my spouse and with my body? Oh, such a great question, and thank you for asking it. And yeah, that some of these concerns can be so vulnerable and can cause so much pain in a relationship. That I think there's no easy fix for some of these things, especially that run so deep. But having these conversations together, if it feels safe and useful, to talk about, the feeling of being objectified, if that's the case, or the feeling of objectifying yourself, if that's the case, and saying, how can we break out of that and see each other as more than just bodies or more than just sexual objects, right? That those can be important kind of beginning conversations to have. And then, mending your own relationship with your body. I think some of those same principles of, can I do that internal work of challenging some of those ideas of, does this message really serve me and the way that I want to view my body, or does it not? And if it doesn't, how can I challenge that and substitute it with a message that does help me to feel more of a whole being and more of a worthy being, right? Someone who has worth besides what my appearance is. I think therapy can be a great place to work some of those struggles out. Not the only place, of course, but a helpful resource, just because that ongoing internal work can be deep and it can be vulnerable and usually just isn't a one and done type of thing, right? Okay, let's see. Okay, what about the lack of compliments in appearance? How does that affect body image? That's a great question, right? That, sometimes our partners might not be as naturally prone to giving those types of comments or compliments, right? And so I'd say it's good to pay attention to that and ask for it. So how does it affect body image? I think that's going to be different for each person, right? Where for some people, it might not be a hindrance to their own perception of their body. I'm not aware of exactly what the research is completely on this, but I'd say that, how it affects you personally can be the most important place to begin, right? Like, is the lack of compliments on my appearance impacting me? And why is that, right? Do I want to ask for more compliments from my spouse? Do I want to have a conversation about what helps me to feel more appreciated or more attractive, right? That those are good things to discuss as a couple. So I'm not aware of any specific research on that, but we do have that research that I shared before that that compliments can help, right? At least in that study that was conducted. Okay. How to be preventative about poor body image. Right now, I'm feeling pretty okay, actually. How do I make boundaries or take preventative measures against body image issues I don't have yet, but may face later in my life? I'm engaged and virgin. Okay, awesome. And so awesome that you are asking these questions before getting married. So being preventative about body image, I think, is one of the most important questions you can be asking. So being aware of, what are the messages that I'm currently getting that might leave me vulnerable, right? That some days are more vulnerable than others, but on those days where you might be feeling more body criticism, maybe even writing down, what are the messages that I'm kind of telling myself about my body? And then taking each of those messages and saying, now, where did this come from? Right? Where did this weed come from? And what do I want to do with this idea? Do I want to keep it? And do I want to kind of listen to it and align my actions with it? Or is it something that I want to separate myself from and challenge, right? That those can be ways to kind of prevent those body image vulnerabilities. And then again, I think that general principle of seeing your body as more than just what it looks like, and seeing your body for all of its functions, all of the things that it allows you to experience, all of the things that, kind of help you to feel alive, right? That might sound kind of cheesy, but being in your body is a great way to foster body image resilience rather than just looking at your body or thinking, how do others look at my body? So kind of a simplistic answer for a really complex issue, but I think those are some of the general principles that can be helpful. Okay. Oh, and someone just notified me there is a question in the regular chat. Okay, thank you. What if I'm having trouble seeing the good in my partner's body? Is that something that can change, or does that have to do with attraction? If I don't feel like my partner is in good health, is it okay to encourage that we both work on being more healthy? Okay, great questions. So there's a few in there that I'll try to answer. So having trouble seeing the good in your partner's body, right? So that can be challenging, right? Especially because our bodies change and our partner's bodies are going to change, right? And so of attraction to one another might also undergo shifts, right? But think about the larger goals of your relationship, and think about what are my hopes for the future of this relationship, and how does their appearance or my perception of their appearance weigh in on that goal, right? That it might hold a lot of weight, it might hold a little bit of weight. If it's holding less weight, as far as how important it is to you, I think that's a place to kind of step back and say, yeah, what are the things that make my spouse or my partner attractive to me, including their appearance, right? But not just their appearance, because attraction is a multifaceted phenomena, right? That we are visually attracted, but we can also be intellectually attracted. We can be spiritually attracted. We can be aesthetically attracted. We can be erotically attracted, right? There are lots of different elements of that. And so being able to kind of have a holistic view is going to be helpful for a lot of different reasons, right? So, and then as far as health goes, right, and I think that way of wording it is, let's work on adding more health promoting behaviors into our lives versus, we need to lose weight, or we need to look thinner, or we need to be more muscular, right? That those appearance-based approaches are going to end up having a more negative impact than being proactive about adding healthy behaviors, right? That we can focus on health promoting behaviors without focusing on weight or appearance. Okay. Let's see. Sorry, we've got lots of questions, and I know I'm not going to get to all of them, and I apologize for that, but I will try to get to as many as I can. Let's see. Do you have suggestions for research on surgical menopause without hormone replacement and getting a better body image? Sorry, I've got to fix my window here. Between surgery and no hormones, I'm always tired and can't lose weight. It's really affected my body image over the last couple of years. Yeah. No, great insight there, right? Because some of those hormonal changes where so much is out of our control can be so tough. And so, I think this is another place to kind of come back to that idea of resilience, right? That we're not always going to love the way that our bodies look, and that is not a condition for having healthy body image. That sometimes we can really dislike the way our bodies look and be really dissatisfied with kind of the visual that we're getting. And that doesn't have to completely define our relationship with our bodies, and it doesn't have to define the choices that we make either. That, body image is not something that's ever going to feel perfect or positive all the time. But if we can kind of step back and say, what else is there in my life that's also important? That can be a way of kind of, putting those body image struggles into perspective that allows them to be more manageable, right? Because things like illness or surgery or, accidents or pregnancy or postpartum or aging, all of those things that we talked about at the beginning can be very difficult, right? They can create changes in our bodies that are just like startling and difficult to deal with. And so seeing our bodies as more than just their appearances and more than their shape and size, and also saying, what else is important to me, and how does my body help me experience those important things, can be a way to manage that. It's not easy though. So much compassion, for all of us that are at some point going to have this struggle. Okay, right. Let me jump back over here. Okay, I know that there were times that women who were heavier were more attractive, and now it's become women who are thinner. Where have those shifts in ideal body image come from? What is the history behind body image in the past, especially when media was not always around? Wow, super interesting question. I love that. So I'm going to have to give a really short answer for something that, there's a lot to say on here, but I think the idea that we are very culturally driven and that not all cultures are the same can be a great way to help us challenge those body image messages, right? That, like you're saying, for a long time, a more robust figure was more attractive. And then, sometime in the 1960s, there was a model named Twiggy who had a very waifish sort of look, a very thin body, thin face, thin limbs, and just exploded in popularity, right? That was the kind of the it look. And, we can even see it right now that, when I was a teenager, it was kind of that, flat tummy, flat chest, flat butt even, right? And very thin look for women. And now, there's more popularity in kind of the Brazilian butt lift look, and the Kardashians kind of defining that. So there's a lot of reasons why those cultural shifts happen, especially when it comes to female bodies, but this is also happening for male bodies, right? That there's the ideal of being super built, right, or super muscular, and that can have a real negative impact on male body image as well, right? So that's going to shift even year to year, right, or decade to decade. And that can be part of how we challenge body image struggles, is saying, okay, yeah, this is a cultural phase, and it's not something that needs to define my self-worth or the way that I see other people's self-worth. Okay. All right. Let's see. Okay. I'm a bit confused because even if we want to believe our fat bodies were good, it's just not that it's not just the media that tells us otherwise. Even our medical world classifies our bodies as overweight at set points, and then warns us about all the undesirable problems that will ensue. How do we ever feel good about our bodies knowing this? Are we supposed to lie to ourselves in order to change our love for our bodies? Oh, such a good question. Because absolutely right that in the medical world, there is weight bias, right? That there's weight stigma that can be harmful to people, right? That, for example, if someone in a thin body goes and complains of knee pain, they're going to get their knee examined, right? They're going to maybe have an MRI or an X-ray and see what the problem is. But often someone who's in a larger body might go in with knee pain and be told, you need to lose weight, right? That's immediately the solution. And so that type of dismissal can be very invalidating and can create a lot of problems as far as how we view our bodies, right? That someone in a larger body might have more struggles, definitely will have more struggles in confronting some of these messages, because they're not just coming from the media, they're coming from lots of different places. So again, I'd encourage you to look at the research on health at every size, or HAES, HAES is the acronym that will help you find that information. That actually what the research tells us is that, some of the risk factors that have been traditionally associated with higher weight are not actually evidenced in the research, right? That there is more variety to the number of factors impacting our health than just weight and size. And that, oversimplifying that can be very harmful, especially in a healthcare setting, right? So again, focusing on what kinds of health promoting behaviors can I add into my life, whether that's more variety in my diet, right? Or getting more fiber, right? Or getting more sleep, being better hydrated, moving my body in ways that feels beneficial and can help strengthen my muscles and improve my cardiovascular health, right? Those are all things that you can focus on adding into your life without having to focus on weight as a measure of whether or not you're doing well, right? That weight can and does change as we change our habits, but isn't necessarily an indicator of health. And it's okay for you to challenge that idea even in your own life, right? That you can be adding in health promoting behaviors and know that you're taking good care of your body, even if your weight does not change, or even if your weight goes up, right? That may be the case for some people, right? So that weight is not the only place you need to focus. And if you're finding that you're running into that with your physicians, that it's okay to find another doctor, right? That there are physicians that are aware of the research on health at every size and can support, interventions that are based in that evidence. Okay. All right. Okay. Sorry, we've got a whole bunch of questions. I'm trying to keep track of which ones I've answered. Okay. What interventions are best to learn body acceptance, neutrality, and love when your body drastically changes postpartum? Great question. So, I think this one can be really challenging just because, those changes can be incredibly drastic and unexpected and really jarring, right? So, I like that you're wording this question as body acceptance or neutrality or love, right? That it doesn't have to be, yes, I love the way that my body looks, right? But can we appreciate, here's the experience that I'm having in my body, right? Again, that getting into your body is a place where you can find a lot of information that we miss when we're out of our bodies and in our heads, right? And so especially when it comes to your sexual relationship, right, that having sex in your postpartum body might feel different in many ways than it did before your baby, right, or during pregnancy, and might look different than it did before your baby or pregnancy. So being able to kind of say, what am I experiencing in my body? And can I add more of what feels good in my body? Can I have that be a place of kind of my home, right? That sensation and that experience in the physical body versus what we think about when we're judging our bodies from the outside, right? The body acceptance and body neutrality, just as in their names even, are about accepting what is versus judging what is, right? And so in order to accept what is and be aware of what is, we have to be in the moment, right? So some of those mindfulness techniques of, I'm focusing on the sensations in my hands or in my skin, right? Or I'm focusing on even just the feeling of breathing. All of those things can be a practice for helping us get back into our bodies when, body image concerns or judgments of our bodies are kind of taking us into our heads. Okay. All right, so we've got still a lot of questions and we're almost at time here. I'll go ahead and answer just two more because I want to be respectful of everyone's time and the time on the recording, but so we'll just do two more. Okay. Okay. What advice do you have for people with chronic physical pain and how this affects body image and physical functionality? Okay, awesome question. Yeah, and this one can be a really difficult one for sure, right? That chronic pain is both an embodied experience, right? A physical sensation-based experience, and it can be one that impacts body image, right? How we view our bodies. So, I think again, this is a place where acceptance can be a very powerful tool, right? That often when we are kind of caught in that struggle of, okay, here's what's happening, but I don't want it to happen, that can really impact our ability to cope because it kind of creates distress on top of distress, right? That having chronic pain is inherently painful, of course, and can be distressing. And then having distress about that distress, right? Like kind of wishing that it wasn't there, which makes sense, right? And kind of pushing against that experience can create just an additional load of difficulty. And so being able to kind of sit with, okay, here's what is, right? Which might even involve a grieving process, right? Of, yes, I'm grieving the previous function of my body or my previous experiences in my body that are now different because of this chronic pain. That can be a powerful tool, not an easy one to use for sure, but one that can help that person arrive to a place of kind of neutrality and acceptance with some of those things. So of course not easy, but one that can be a challenge, right? So, and this principle can apply whether that's, with chronic pain or a physical appearance change, right? Like if there's been an accident or a surgery or weight gain or something like that impacts, that it's okay to mourn the experience that you had before that you're leaving behind. And also, be able to say, and now what do I want for myself moving forward? What do I value? What do I want to cultivate in my relationship with my body that I can put my energy towards, even when that kind of grief starts to drag me away from it, or, kind of resisting this change or wishing that it weren't here, or being upset with that change or with myself might sort of start to drag you away from that. Finding a place to kind of anchor yourself of what do I want to value in my relationship with my body and how can I give energy to that? So not an easy thing. And again, a very simplistic answer for a very complex and often really distressing kind of experience. Okay, so one more question. Let's see. Let's go with this one. If there's not, okay. Any tips for maintaining good body image while shopping for clothing? That's usually where I struggle the most and especially feel worse about my sex appeal. Great question. So I think one really powerful thing with clothing is that clothing sizes are really tricky and can be very triggering for body image experiences, right? So making sure that you're approaching clothing shopping as I am looking for clothes to fit my body, right? Clothes that will serve my body, rather than berating myself or criticizing my body for not fitting the clothes, right? So I think that can be one tool, right? And allowing yourself to say like, okay, this is the wrong size, right? That we would do that with shoes, right? If we were shopping for shoes and like I wear a size like 8.5, and if I accidentally grab a 6 and my feet don't fit into it, I'm probably not going to be upset with my feet for not fitting into that shoe. I'm just going to go grab my 8.5 that will fit, right? But that can feel trickier when it comes to pants or shirts or other pieces of clothing, right? So allowing that permission to say, I am allowed to be in clothes that fit my body and that allow my body to feel comfortable, rather than criticizing my body because it doesn't fit the item of clothing that I decided to put on it. Right? That can be a really simple thing that can make a big difference. Okay. And I wish I had time to answer more of the questions, because there are a lot of great ones here, but I'm going to have to stop there just for sake of time. So just one quick thought. There's going to be a short survey that will, I think, be sent to you after this webinar is over, from the Utah Marriage Commission. I just encourage you to fill that out. Just takes a few minutes and gives a lot of valuable information to the organization for finding what's helpful for the participants. So please go ahead and complete that survey if you can. And thank you so much for participating and for your time.
Thank you, Jessica. That was amazing. And thanks for taking all of that time to answer so many questions. You really, I think you hit most of them. So good on you.
Thanks.
So yeah, just if you can fill out the survey, it'll pop up right when you log out here. And everyone who registered will receive a recording of this webinar tomorrow. You can share with friends or rewatch. You'll receive it via email. And yeah, that's everything. Thank you again, Jessica. You were great. And thank you everyone for showing up today and participating in the chat. I'm seeing tons of thank yous in the chat box.
No, thank you everyone. Thanks for participating.
Okay. Have a great evening.